Welcome to our medical assistant practice test. This test consists of 100 questions designed to help you prepare for your medical assistant certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. An HMO is A. A group model of managed care. B. A health model that emphasizes preventative care. C. Can be part of a group or a single organization. D. All of the above. Correct answer, D. All of the above. HMOs are health maintenance organizations. This type of managed care system is set up to emphasize well care to reduce the number of illnesses a patient suffers, which will lower the overall cost of the plan as a whole. 2. To qualify for Medicare, a person must meet which of the following criteria? A. Must be 65 or older unless disabled. B. Must have contributed to FICA in the past. C. Must have received Social Security disability for more than 1 year. D. All of the above. Correct answer, must be 65 or older unless disabled. To qualify for Medicare, a patient must fall into one of several groups which could include being age 65 or older, being a spouse of an employee currently contributing to FICA, or being a person who has been receiving Social Security disability for more than 2 years. 3. A patient receives Medicaid, but is also covered under TRICARE. Which plan would serve as primary payer? A. Medicaid. B. TRICARE. C. CHAMFA. D. None of the above. Correct answer, B. TRICARE. When a patient is covered by TRICARE and another health insurance policy, TRICARE is the secondary payer. However, when the second policy is Medicaid, TRICARE is the primary payer. 4. Workmen's compensation claims. A. Are federally managed. B. Are kept separate from other insurance claims which are not workmen's comp in nature. C. Are to be shared with the patient's employer with full medical record review. D. None of the above. Correct answer, B. Are kept separate from other insurance claims which are not workmen's comp in nature. Workmen's compensation files are to be kept separate from a patient's usual medical record. These forms are filed to the state for claims for payment. 5. I-9 forms are A. Required by the federal government. B. Require the employer to verify forms of identification. C. Filed within 3 business days of hire. D. All of the above. Correct answer, D. All of the above. I-9 forms are required by federal law to confirm the identity of employees. These forms are required to be filed with the federal government within 3 days of the employee's hire date. 6. Liabilities are debt obligations. Which of the following formulas is accurate when calculating liabilities? A. Liabilities equals assets plus owner equity. B. Liabilities equals owner equity, assets. C. Liabilities equals assets, purchaser's equity. D. Liabilities equals assets, owner's equity. Correct answer, D. Liabilities equals assets, owner's equity. The proper accounting formula to calculate liabilities or monies owed to others is calculated by subtracting the owner's equity from total assets. 7. Which of the following collection scenarios is allowed by law? A. To ensure that someone will be available to take the call, collectors should call debtors after 10 p.m. B. To make the point clear to debtors, collectors should call the debtors daily until all debts are paid in full. C. Collections mailings should be sent daily on postcards to save money on postal notifications. D. All of the above are illegal collections practices. Correct answer, D. All of the above are illegal collections practices. Collections practices must be conducted within the parameters of the law. Collections calls should be done while maintaining the debtor's privacy and only during the hours of 8 a.m. until 8 p.m. 8. When referring to collections, what is a skip? A patient who omits or skips a payment. B. A patient who has moved purposely to avoid paying a bill. C. A gesture of goodwill by the collections agent where a collections call is skipped for 1 month. D. None of the above. Correct answer, B. A patient who has moved purposely to avoid paying a bill. A skip is a patient who purposely moves to delay or avoid paying money owed to practice. Skips can be traced by checking with a patient's employer or the Department of Motor Vehicles for a forwarding address. 9. To obtain collections through small claims court. A. Judgment must be made on behalf of the plaintiff. B. An attorney is not necessary. C. A judge will pass judgment but will not collect funds owed to the practice. D. All of the above. Correct answer, D. All of the above. Small claims court has the benefit of a short turnaround time for judgment and cost savings over attorney-directed collections lawsuits. Claims should be less than $5,000 and an attorney is not necessary. A judge will make a decision but the office still has the responsibility of collecting the funds owed. 10. Which of the following labor situations is unlawful? A. An employee is told to retire because she has turned 65 years old. B. Telling an employee that she must take a lunch period. C. Not paying an employee who has run out of sick time for hours spent off the clock due to illness. D. All of the above are lawful situations. Correct answer, A. An employee is told to retire because she has turned 65 years old. Employees cannot be told to retire. In addition, age discrimination is covered by Equal Employment Opportunity Commission and is also unlawful. 11. A physician visited a nursing home and billed 10 patients, however, he only provided services to 8 of them. This is referred to as A. Ping-ponging. B. Unbundling. C. Gang visit. D. Split visit. Correct answer, C. Gang visit. Medicare fraud is intentionally billing Medicare for services that were never provided. A gang visit is an example of this, billing patients when not all patients were provided services. 12. Patients that are exhibiting signs of cyanosis will A. Show signs of hyperoxia. B. Will have increased O2 saturation. C. Will have blood levels of CO2 that are higher than O2 levels. D. None of the above. Correct answer, C. Will have blood levels of CO2 that are higher than O2 levels. Cyanosis is defined as a condition of being blue. This condition occurs when patients are having difficulty oxygenating their tissues. Blood gas chemistry results will show low blood oxygen levels and high CO2 levels. 13. The medical term, diaphoresis, means A. Profuse vomiting. B. Profuse sweating. C. Gasping for air. D. None of the above. Correct answer, B. Profuse sweating. Diaphoresis is a medical term meaning profuse sweating, and is often associated with emergency situations such as heart attacks or diabetic episodes. 14. When would chest thrusts be performed in an emergency situation? A. When performing CPR to initiate cardiovascular circulation. B. When assessing responsiveness of an unconscious patient. C. When assisting a pregnant woman who is choking. D. None of the above examples indicate the need for chest thrusts. Correct answer, C. When assisting a pregnant woman who is choking. To properly attempt to dislodge solid materials from the airway of a pregnant woman, chest thrusts are used in lieu of abdominal thrusts. Chest thrusts, while not as effective as abdominal thrusts, will reduce the risk of harming the fetus. 15. When receiving CPR certification through the American Heart Association at the healthcare provider level, how often is recertification necessary? A. Annually. B. Biannually. C. Every 2 years. D. Certification is a one-time training and the credential is good for the life of the certificant. Correct answer: C. Every 2 years. CPR certification should be renewed every 2 years to ensure that providers are kept up to skill and are aware of new trends and procedures related to resuscitation. 16. A 56-year-old female complained of dizziness, weakness, and diaphoresis. The patient is a known diabetic. You took the patient's blood sugar and it showed hypoglycemia. What is the next best step? A. Give her nitroglycerin. B. Give juice, candy, or soda. C. Assess the patient's airway. D. Perform ECG. Correct answer: B. Give juice, candy, or soda. In diabetic emergencies, such as hypoglycemia, giving a sugar source is the next best step. A sugar source can be juice, candy, or soda. 17. A patient was stung by a bee while on a camping trip. After 30 minutes, she complained of wheezing and hives. Most likely, the patient has A. Asthma. B. Shock. C. Anaphylaxis. D. Stroke. Correct answer: C. Anaphylaxis. Anaphylaxis is a life-threatening allergic reaction to an allergen. Symptoms of anaphylaxis include shortness of breath, hives, itchiness, swelling, chest discomfort, nasal congestion, abdominal discomfort, dizziness. 18. You found a patient lying on the ground. As a medical assistant, what is the first step to determine if the patient needs CPR? A. Check chest compressions. B. Check the carotid pulse. C. Confirm if the patient is unconscious. D. Give mouth-to-mouth resuscitation. Correct answer: C. Confirm if the patient is unconscious. If a person has collapsed, check if the person is unconscious. Gently shake the patient and shout, "Are you okay?" If there is no response, call for help. Call 911 or your local emergency number. 19. What artery should be palpated during cardiopulmonary resuscitation, CPR, to determine the presence of a pulse? A. Carotid pulse. B. Femoral pulse. C. Brachial pulse. D. Radial pulse. Correct answer: A. Carotid pulse. A carotid pulse is the pulse that can be felt on the right side of the neck, over the carotid artery. In CPR, the carotid artery can be felt on both sides of the Adam's apple for 5 to 10 seconds. 20. A sigmoidoscopy is performed to examine the small intestine. B. Rectum. C. Large intestine. D. Lungs. Correct answer: C. Large intestine. The sigmoid is the last part of the large intestines. Sigmoidoscopy is the visual examination of the last part of the colon. 21. A medical assistant does not need to wear gloves when A. Performing blood pressure. B. Transporting a urine specimen. C. Lubricating a Foley catheter. D. Performing venipuncture. Correct answer: A. Performing blood pressure. Generally, medical personnel do not wear gloves when performing blood pressure. Wearing gloves is recommended in transporting possibly contaminated fluids such as transporting a urine specimen, lubricating a Foley catheter, and drawing blood. 22. A patient complains that he has had chest pains for 3 months associated with dyspnea and diaphoresis. He self-medicated with aspirin and antacids. Which part of the medical history should this information be placed? A. Chief complaint. B. Present illness. C. Past history. D. Family history. Correct answer: B. Present illness. The information presented should be placed under the present history or the history of present illness. The present history is the detailed information of the patient's chief complaint. 23. You have been monitoring the oral temperature of Mr. Hadley for the past 10 days. His temperature shows that he is having alternating febrile and afebrile days. This type of fever pattern is known as A. Continuous fever. B. Remittent fever. C. Intermittent fever. D. Relapsing fever. Correct answer, C. Intermittent fever. Intermittent fever is when the patient has alternating days with fever and days with normal temperature. Malaria is an example of a disease where fever comes and goes. 24. What does pulse oximetry evaluate? A. It measures the heart rhythm of the patient. B. It measures the pulse and the respiration of the patient. C. It measures oxygen saturation in arterial blood. D. It measures oxygen saturation in venous blood. Correct answer, C. It measures oxygen saturation in arterial blood. Pulse oximetry is used to measure oxygen saturation in arterial blood. It is considered to be a non-invasive, painless, and a general indicator of oxygen delivery to the tissues. 25. Which of the following statements is an example of an open-ended question? A. Do you have more than one symptom? B. Tell me more about your symptoms. C. Do you have hypertension? D. Does your family have diabetes? Correct answer, B. Tell me more about your symptoms. Open-ended questions are questions which require more explanation than a simple yes or no answer. Close-ended questions are questions which can be answered by a simple yes or no. 26. All of the following are components of the infection cycle, except A. Reservoir. B. Means of transmission. C. Susceptible host. D. Means of termination. Correct answer, D. Means of termination. Means of termination is not a component or link to the infection cycle. The links to the infection cycle are infectious agent, reservoir, portal of exit, transmission, portal of entry, and susceptible host. 27. Normally, the pulse rate is the same as the A. Number of heartbeats in 1 minute. B. Average length of beats in 1 minute. C. Number of heartbeats in 30 seconds. D. Difference between systolic and diastolic pressure. Correct answer, number of heartbeats in 1 minute. The pulse rate should be the same as the heart rate. The pulse is the throbbing motion as the wave of blood hits the artery wall during heart activity or heartbeat. 28. Which of the following is not properly part of the interviewing process to obtain patient medical history? A. Observe the patient's alertness, level of orientation, grooming and comfort. B. Express concern and respect for the patient. C. Place the patient in a private room. D. Judging the behavior of the patient. Correct answer, D. Judging the behavior of the patient. Making conclusions or judgments about the patient's behavior is not a proper way of interviewing patients. The purpose of the interview is to find the diagnosis and to treat the patient correctly. 29. The purpose of ear installation is to A. Clean the ear. B. Dilate the ear. C. Treat otitis externa. D. Enhance hearing of the patient. Correct answer, C. Treat otitis externa. The purpose of ear installation is to treat otitis externa or media. Medicine instilled into the ear is absorbed through the skin of the ear canal and membranes of the eardrum. It is used primarily to treat wax buildup and inflammations or infections of the ear. 30. Mrs. Simon, a known diabetic, came to your clinic because of dizziness. When you took her blood pressure while she was lying down on the bed, her blood pressure was 110/70 mmHg, but when she stood up, she started to become dizzy again. A repeat blood pressure was 80/50 millimeter of mercury. What would be the condition of the patient? A. Normal. B. Malingering. C. Having malignant hypertension. D. Having orthostatic hypotension. Correct answer, D. Having orthostatic hypotension. The patient has orthostatic hypotension or postural hypotension. Orthostatic hypotension is defined as a decrease in systolic blood pressure of 20 mm of mercury, or a decrease in diastolic blood pressure of 10 mm of mercury within 3 minutes of standing when compared with a blood pressure from the sitting or supine position. It results from an inadequate response to position changes in blood pressure. 31. Which of the following is the recommended setting for the autoclave? A. 450 F for 30 minutes. B. 175 F for 20 minutes. C. 250 F for 30 minutes. D. 320 F for 20 minutes. Correct answer, C. 250 F for 30 minutes. An autoclave is a pressurized chamber used to sterilize equipment and supplies. The recommended settings for an autoclave is 250 degrees Fahrenheit for 20 to 30 minutes at 15 pounds of pressure. 32. To comply with the Health Insurance Portability and Accountability Act, HIPAA, the physician must provide the patient with A. Office Policy and Procedure Manual. B. Notice of Privacy Practices. C. Current Fee Schedule. D. Staff Member Credentials. Correct answer, B. Notice of Privacy Practices. When requested by a patient, the physician must make the Notice of Privacy Practices available to the patient. These privacy practices are posted in the medical clinic, but each patient can request her own copy. 33. Physicians are required to keep payroll data for how many years? A. 3 years. B. 4 years. C. 5 years. D. For all years the physician owns the practice. Correct answer, B. 4 years. By law, a physician is required to keep payroll data for 4 years. These include Social Security numbers of the employees, the number of withholding allowances claimed, gross salary or hourly wage, and deductions for Social Security tax, Medicare tax, federal, state, and other tax, as well as state disability insurance, and state unemployment tax. 34. During Carol's yearly review, her supervisor complimented her on being trustworthy and reliable. Choose the term that fits this compliment. A. Flexible. B. Dependable. C. Respectful. D. Tactful. Correct answer, B. Dependable. Dependability is an extremely important quality in a medical assistant. This shows reliability and trustworthiness to your employer and will help the medical assistant to further her career. 35. Carissa Martin has just had a first job interview after graduating from a medical assisting degree program. What would be the appropriate follow-up Carissa should take after the interview? A. Carissa should call the person who interviewed her in 2 days and ask if she got the job. B. Carissa should call the person who interviewed her the next week and ask for a second interview. C. Carissa should send a handwritten thank you note to the person who conducted the interview. D. Carissa should send copies of her reference letters to the Human Resources Office the week after the interview. Correct answer, C. Carissa should send a handwritten thank you note to the person who conducted the interview. Carissa should send a handwritten thank you note to the person who conducted the interview. A handwritten thank you note displays courtesy and professionalism. This will help Carissa create an added positive impression. 36. John is the most recent MA to be employed at a pediatric clinic. He felt unappreciated when his suggestion at a staff meeting was considered but not implemented, whereas some suggestions from others were used. What should John's strategy be for further participation in office meetings? A. John should ask to have the next meeting extended to discuss his suggestion further. B. John should focus on being a team player and to put his personal feelings aside. C. John should go ahead with his plan and the supervisor will see his idea works better. D. John should advise his supervisor that he would prefer not to be part of office meetings. Correct answer: B. John should focus on being a team player and to put his personal feelings aside. Every clinic or hospital has a slightly unique philosophy, but when everyone learns to work together as a team and put their personal feelings aside, there is much better productivity and patient satisfaction. This is an important goal for all healthcare facilities. 37. Mrs. Carter, a patient at a health clinic, is quite ill and makes an appointment to discuss some issues with the physician. Prior to her seeing the doctor, Mrs. Carter asks a medical assistant what the formal name is for the document that helps make clear what she wants in the event that her illness becomes terminal. The medical assistant should tell her this would be called A. Living will. B. Euthanasia. C. Trust. D. Durable power of attorney. Correct answer: living will. The living will is a legal document, voluntarily signed by a competent adult, stating what procedures or treatment that person wants done in the event of a terminal illness. 38. Dr. Findlay is retiring and closing his practice. What is the practice required to do? A. Inform the patients that he will no longer be able to assist them. B. Telephone each patient personally and tell them that they should pick up their records. C. Inform the patients in writing that the practice is closing and provide instructions for retrieving their medical records. D. There is no obligation for a practice to take any actions. Correct answer: C. Inform the patients in writing that the practice is closing and provide instructions for retrieving their medical records. When a physician dies or decides to close the practice, the patients must be notified in writing of the time frame for closing and any instructions for retrieving their medical records or how to have the practice transfer their records to another practice. 39. Which of the following methods would best prove that a fax was properly sent to its intended destination? A. The MA should attach a fax confirmation sheet to the original document. B. The MA should call the intended destination to alert them that a fax is on its way. C. The MA should fax the information twice. D. The MA should email the information and fax it. Correct answer: the MA should attach a fax confirmation sheet to the original document. Keeping a copy of the confirmation sheet that can be printed from the fax machine can serve as adequate proof that a fax was sent. This method does not prove that the fax was received. 40. Which of the following examples would be classified as hardware? A. DOS. B. Microsoft Office. C. EMR. D. Modem. Correct answer: D. Modem. Hardware is a piece of equipment used to operate computer machinery. Modems are used to connect a computer to the internet through a telephone line. Modern modems can also connect to the internet through DSL or cable internet providers. 41. The acronym HIPAA is: A. Health Insurance Portability Accrediting Association. B. Health Insurance Portability Accrediting Agency. C. Health Insurance Plan and Accountability Alliance. D. Health Insurance Portability and Accountability Act. Correct answer: D. Health Insurance Portability and Accountability Act. HIPAA is an abbreviation for Health Insurance Portability and Accountability Act. The objective of HIPAA is to protect the confidentiality and security of health information. 42. The following are used as filing methods, except A. Alphabetical. B. Disease. C. Numerical. D. Subject. Correct answer: B. Disease. The three common filing methods used are alphabetical, numerical, and subject. Filling by disease is not a filing method. 43. Which of the following is not a basic step in filing records? A. Conditioning. B. Indexing. C. Purging. D. Coding. Correct answer, C. Purging. Purging is the process of cleaning out files. It is the preparation of a file to go from active status to inactive status. Conditioning, releasing, indexing, coding and sorting are basic steps in the filing process. 44. Which of the following medical terms is misspelled? A. Polycystic. B. Diaphragm. C. Coccyx. D. Bradycardic. Correct answer, C. Coccyx. The proper spelling of the word is coccyx. The other terms are spelled correctly. 45. Which of the following medical terms means surgical fixation of the stomach? A. Abdominoplasty. B. Gastroplasty. C. Gastropexy. D. Abdominorexis. Correct answer, C. Gastropexy. Gastropexy is a medical term meaning to surgically fix the stomach in place. The similarly spelled gastroplasty is a surgical reconstruction of the abdomen. 46. Which of the following abbreviations means before meals? A. AC. B. PRN. C. QID. D. QH. Correct answer, A. AC. The abbreviation meaning before meals is AC. PRN means as needed. QID is 4 times a day. QH means hours of sleep or take at bedtime. 47. A procedure that examines a portion of the large intestine with an endoscope is called A. Colposcopy. B. Sigmoidoscopy. C. Upper GI. D. Cardiac catheterization. Correct answer, B. Sigmoidoscopy. The sigmoid colon is located in the descending colon. A special scope is inserted into the rectum and takes video and still images of the lining of the large intestine. An upper GI is used to take still photos and video of the esophagus and stomach. A KUB is a radiography procedure looking specifically at the kidneys, ureters, and bladder. A cardiac catheterization is a procedure where a thin instrument is placed through the femoral artery and threaded up the vasculature to the heart, where procedures can then be performed. 48. The mitral valve is synonymous with the term left ventricle. B. Right atrium. C. Bicuspid valve. D. Tricuspid valve. Correct answer, C. Bicuspid valve. The mitral valve is also known as the bicuspid valve and can be found on the left side of the heart. The bicuspid valve is located between the left atrium and the left ventricle. 49. In the term hemoglobin, the suffix globin means A. Protein. B. Iron. C. Metal. D. Blood. Correct answer, A. Protein. The word part, globin, means protein. Hemoglobin is a medical term meaning blood protein. 50. A patient suffering from hyperglycemia would be experiencing A. Low blood sugar. B. High blood sugar. C. Normal blood sugar. D. None of the above. Correct answer, B. High blood sugar. Patients with hyperglycemia have a high concentration of glucose in the bloodstream. Most likely the patient will also be diagnosed with diabetes, commonly referred to in layman's terms as the sugar. 51. The root word for bone marrow is A. Spin/O. B. Mile/O. C. Mix/O. D. Ost/O. Correct answer, B. Mile/O. Myelo is the root word for bone marrow. It is also the root word for the spinal cord. 52. The part of the stomach that is connected to the esophagus. A. Fundus. B. Pylorus. C. Body. D. Cardia. Correct answer, D. Cardia. The part of the stomach that is connected to the stomach is the cardia. The fundus is the expanded portion, the body is the bulk of the stomach, and the pylorus is at the bottom end of the stomach. 53. A patient was diagnosed with cardiomyopathy. What does this condition refer to? A. Disease of the electricity of the heart. B. Heart attack. C. Disease of the heart muscle. D. Insufficient blood flow to the heart. Correct answer, C. Disease of the heart muscle. Cardiomyopathy refers to disease of the heart muscle. Cardi/O refers to the heart. My/O refers to muscle and pathy refers to a disease condition. 54. In an ectopic pregnancy, the fertilized egg is most likely developing in what part of the reproductive system of the female? A. Fallopian tube. B. Uterus. C. Ovary. D. Cervix. Correct answer, fallopian tube. A majority of ectopic pregnancies occur in the fallopian tube. Pregnancy should take place only in the uterus. Ectopic pregnancy refers to conception outside the uterus. 55. A physician believes that a patient may be experiencing pancreatitis. Which of the following tests would be best to diagnose this condition? A. CK and troponin. B. BUN and creatinine. C. Amylase and lipase. D. HDL and LDL cholesterol levels. Correct answer, C. Amylase and lipase. Patients experiencing pancreatitis will have increased blood levels of amylase and lipase, two enzymes produced by the pancreas that break down carbohydrates and lipids, respectively. 56. An abnormality in the ventricles may be identified on the ECG strip by A. Distorted, varying P-wave pattern. B. Wide spaces in between waves. C. Wide and bizarre QRS complex. D. Too fast heart rate. Correct answer, C. Wide and bizarre QRS complex. QRS waves represent ventricular contraction. Abnormalities of the QRS represent the ventricles. In the same way, the P waves represent atrial contraction. 57. The standard ECG paper speed is A. 25 mm per minute. B. 25 mm per second. C. 50 mm per minute. D. 50 mm per second. Correct answer, B. 25 mm per second. The standard ECG paper speed is 25 mm per second. Each small box horizontally is 0.04 seconds and 0.1 mV vertically. 58. During an ECG, a patient was talking, moving, and chewing. What interference will show in the strip? A. Damaged cable. B. Loose electrode. C. Somatic tremor. D. Alternating current or 60 cycle. Correct answer, C. Somatic tremor. Somatic tremor is the term for ECG interference for patient movement. It will show a fuzzy baseline on the ECG tracing. 59. Which ECG electrode is placed on the 5th ICS on the left midclavicular line? A. V3. B. V4. C. V5. D. V6. Correct answer, B. V4. The V4 electrode is placed on the 5th ICS on the left midclavicular line. V5 and V6 electrodes are placed on the 5th ICS anterior and mid-axillary lines. 60. Which chest lead is placed on the 4th ICS to the right of the sternum? A. V1. B. V2. C. V3. D. V4. Correct answer, F. V1. A V1 chest lead is placed on the 4th ICS to the right of the sternum. V2 is placed on the left of the sternum. V3 is placed between V2 and V4. V4 is placed on the 5th ICS, left midclavicular line. 61. A patient came to the clinic complaining of waking up at night to urinate. The patient has a family history of diabetes. The patient's symptom is called A. Nocturia, B. Incontinence, C. Polydipsia, D. Oliguria. Correct answer, A. Nocturia. Patients who wake up at night to urinate are referred to as nocturia. This condition can be a sign of diabetes. 62. A patient was brought to the clinic because she has not urinated for 3 days. Blood tests shows increase in BUN and creatinine. What is the condition of the patient? UTI, B. Kidney stones, C. Uremia, D. Diabetes. Correct answer, C. Uremia. The patient has uremia based on the blood tests. Uremia is accumulation of wastes in the blood such as BUN and creatinine due to renal disease. 63. Which of the following is not considered to be computer hardware? A. Mouse, B. Windows, C. Printer, D. Scanner. Correct answer, B. Windows. Windows is a computer operating software. Mouse, printer, and scanners are considered computer hardware. Hardware refers to the physical components that make up a computer system. 64. What is a PILMAR chart? A. A method of recording data about the signs and symptoms of the patient. B. A method of recording data about the health status of a patient in a problem-solving system. C. A method of recording data about the physical examination of the patient. D. A method of recording data about the diseases that run in the family of the patient. Correct answer, B. A method of recording data about the health status of a patient in a problem-solving system. A problem-oriented medical record, PILMAR, is a chart about the health status of a patient in a problem-solving system developed by Dr. Larry Weed in the 1950s. The basic components of the PILMAR are I. Database, history, physical exam and laboratory data. 2. Complete problem list. 3. Treatment plans. 4. Daily progress note. V. Final progress note or discharge summary. 65. What device prints postage directly onto mail pieces or labels? Stamper. B. Postage meter. C. Engraver. D. Laser printer. Correct answer, B. Postage meter. A postage meter is a mechanical device used to create and apply physical proof of mail. They are also called as postage machines or franking machines. 66. A written statement that promises the good condition of a product, and states that the manufacturer is responsible for repairing or replacing the product usually for a certain period of time after its purchase. A. Liability. B. Contract. C. Agreement. D. Warranty. Correct answer, D. Warranty. A warranty is a written statement that promises the good condition of a product and states that the maker is responsible for repairing or replacing the product. A warranty may be expressed or implied, depending on whether the warranty is explicitly provided. 67. Which of the following is a method of documentation used by healthcare providers to write out notes in a patient's chart, along with other common formats, such as the admission note? A. Physical examination. B. SOAP notes. C. Prognosis chart. D. Review of systems. Correct answer, B. SOAP notes. SOAP notes is a documentation method employed by healthcare providers to create patient charts. There are 4 parts of a SOAP note: subjective, objective, assessment, and plan. 68. The electronic conversion of scanned or photographed images of typewritten or printed text into machine-encoded or computer-readable text is called A. Optical character recognition. B. Overcurrent relay. C. On-channel repeater. D. Operating conditions register. Correct answer, A. Optical character recognition. OCR is the abbreviation for optical character recognition. It converts scanned images of printed text into computer-readable format. 69. A device that reads documents and converts them into digital data. A. Printer. B. Scanner. C. Flash drive. D. CPU. Correct answer, B. Scanner. A scanner reads or converts printed material directly into a format readable by a computer. It captures images from photographs, prints, and similar sources for computer editing and display. 70. This report is dictated by the admitting physician at the end of the patient's hospital stay. It is a brief statement of everything that occurred throughout the hospital course. A. Consultation report. B. Operative report. C. Pathology report. D. Discharge summary. Correct answer, D. Discharge summary. A discharge summary is a report prepared by a physician or other health professional at the end of the hospital stay. It outlines the patient's history, the diagnosis, and management on discharge. 71. A small, lightweight removable storage device, also called a thumb drive. A. Lawn drive. B. URL drive. C. USB drive. D. Zip drive. Correct answer, C. USB drive. A USB, Universal Serial Bus, drive is a small, lightweight removable storage device. It is also called flash drive, memory stick, or thumb drive. 72. To prevent intruders from accessing computer networks, which of the following is used? A. Server. B. Scanner. C. Firewall. D. Database. Correct answer, C. Firewall. A firewall is a software program that helps screen out hackers, viruses, and malwares that try to access computers over the internet. Firewalls can be installed in both hardware and software, or both. 73. Patients who have diets deficient in calcium will have which of the following symptoms? A. Bruising. B. Osteopenia. C. Kyphosis. D. All of the above. Correct answer, D. All of the above. Calcium is a major component of strong bones. Deficiencies in this mineral can lead to weak bones and bruising. Calcium also plays a role in the clotting process. Kyphosis is a condition where the bones of the vertebral column become weak, causing a humpback posture. 74. The most commonly abused drug in children under 18 is A. Alcohol. B. Marijuana. C. Crack. D. Cocaine. Correct answer, A. Alcohol. Alcohol is the most commonly abused drug in children under the age of 18. 75. A 17-year-old patient was brought to the clinic because of bruises and hematoma. There was no history of trauma, accident, or injury. The patient's history is positive for blood disease. If the patient has a vitamin deficiency related to the blood, in which vitamin is she deficient? A. Vitamin A. B. Vitamin E. C. Vitamin K. D. Vitamin B. Correct answer, C. Vitamin K. Vitamin K is also known as the clotting vitamin. Vitamin K deficiency occurs when the body cannot properly absorb the vitamin from the intestinal tract. Vitamin K deficiency can also occur after long-term treatment with antibiotics. 76. Which diet helps in preventing constipation? A. High fiber. B. Low residue. C. Low fiber. D. Bland. Correct answer, A. High fiber. Dietary fiber refers to the edible parts of fruits, plants, nuts, seeds, and legumes that cannot be digested. There are two types of fiber, soluble and insoluble. Both types of fiber are essential for making the intestines healthy. Soluble fiber allows more water to remain in the stool, making waste softer and easier to pass. 77. Scurvy is caused by what vitamin deficiency? A. Vitamin K. B. Vitamin A. C. Vitamin D. D. Vitamin C. Correct answer, D. Vitamin C. Vitamin C deficiency is referred to as scurvy. Scurvy causes general weakness, anemia, gum disease, and skin hemorrhages. 78. This vitamin helps the skin, nails, hair, and sharpens the vision. A. Iron. B. Folic acid. C. Vitamin A. D. Vitamin E. Correct answer, C. Vitamin A. Vitamin A is one of the fat-soluble vitamins. Vitamin A helps and maintains the health of the skin, hair, and nails. Vitamin A also promotes good vision, especially in low light. It may also be needed for reproduction and breastfeeding. 79. How a drug is processed and cleared in the body is referred to as A. Metabolism. B. Antagonism. C. Distribution. D. Synergism. Correct answer, A. Metabolism. Metabolism is the conversion of one chemical compound into another. Most drug metabolism occurs in the liver. The result of drug metabolism is to make the drug less active and less toxic or harmful. 80. The prefix centi means A. 1/100th of a unit. B. 1,000th of a unit. C. 1/1,000,000th of a unit. D. 1/10th of a unit. Correct answer, A. 1/100th of a unit. Centi is a prefix that is a factor of 1/100th. It is written as 0.01. 81. The part of the prescription that tells you if the drug can be replaced by the pharmacist. A. Repetator. B. Dispense as written, DAW. C. Subscription. D. Signature. Correct answer, B. Dispense as written, DAW. If the doctor writes the prescription and does not mark the DAW box, the pharmacist can substitute a generic version of the drug. This can save the patient money, while still providing the patient with medication equivalent to the prescription. 82. This injection technique or route of administration is performed at an angle of 90 degrees. A. Subcutaneous injection. B. Intravenous injection. C. Intramuscular injection. D. Intradermal injection. Correct answer, C. Intramuscular injection. Intramuscular injections are inserted at a 90-degree angle. Examples of IM drugs are HPV, tetanus, diphtheria, hepatitis A and B. 83. If the medication is supposed to be given Q6, how many times will you give the medication to the patient in a day? A. 4. B. 5. C. 3. D. 6. Correct answer, 4. The abbreviation Q6 refers to every 6 hours. If the medication is to be given every 6 hours, then it should be given 4 times in a span of 24 hours. 84. The prescription signature, SS tab TIDX 14D means A. 1/2 tablet 3 times a day for 14 days. B. 1/2 tablet every 3 hours for 14 days. C. 1/2 tablet every 6 hours for 14 days. D. 1/2 tablet 4 times a day for 14 days. Correct answer, A. 1/2 tablet 3 times a day for 14 days. The signature SS tab TIDX14D means take 1/2 tablet 3 times a day for 14 days. The signature of the prescription tells the patient directions on how to take the drug. 85. This injection or route of administration is usually given during PPD. A. Subcutaneous injection. B. Intravenous injection. C. Intramuscular injection. D. Intradermal injection. Correct answer, D. Intradermal injection. PPD injections for diagnosis of tuberculosis is performed using the intradermal injection technique. Intradermal injection is the injection of a small amount of fluid into the dermal layer of the skin. 86. The part of the prescription that gives the refill information. A. Inscription. B. DAW. C. Signature. D. Repitator. Correct answer, D. Repitator. Reparator is the part of the prescription that tells the pharmacist if the medication can be refilled or not. It also gives information on how many times it can be refilled. 87. The abbreviation S.O.S means A. At night. B. Immediately. C. If necessary. D. By mouth. Correct answer, C. If necessary. In prescription writing, SOS means if necessary. STAT means immediately, HS means at night, and PO means by mouth. 88. What abbreviation means drops? A. SC. B. PC. C. HS. D. GTT. Correct answer, D. GTT. The abbreviation for drops is GTT, subcutaneous is SC, at night is HS, and after meals is PC. 89. Dr. Dasvan receives a legal document requiring him to appear in court and to provide a patient's original medical record. What Latin phrase describes this situation? A. Residential ipso loquitur. B. Respondeat superior. C. Subpoena duces tecum. D. Stare decisis. Correct answer, C. Subpoena duces tecum. Subpoena duces tecum is a legal document that requires a person to appear in court with specified documents, which can include a patient's original medical record. This Latin phrase means, bring with you under penalty of punishment. The subpoena will define exactly what documents are to be brought to court. 90. Which of the following is not a barrier to communication? A. Embarrassment. B. Stereotyping. C. Withdrawal. D. Acknowledgement. Correct answer, D. Acknowledgement. Acknowledgement is an action of expressing gratitude or appreciation for something. It is not a barrier to communication. Embarrassment, discomfort, language problems, withdrawal, prejudice are all examples of barriers to communication. 91. An employee hates her superior, but instead of acting in accordance with her feelings, she overly cares for him and expresses a desire to retire with the company someday. What defense mechanism is the employee exhibiting? A. Denial. B. Projection. C. Sublimation. D. Reaction formation. Correct answer, D. Reaction formation. Reaction formation is the converting of unwanted or dangerous thoughts, feelings, or impulses into their opposites. For example, an employee who hates her superior may instead be overly caring towards him, and expresses to retire there. 92. A belief that all members of a culture, subculture, or group are the same. A. Prejudice. B. Projection. C. Stereotyping. D. Maligning. Correct answer, C. Stereotyping. Believing that all members of a culture, subculture, or group are the same is stereotyping. It is a way to reduce the amount of thinking we have to do when we meet someone new. 93. An employee becomes angry with his boss. Instead of expressing his anger to the boss for fear of losing his job, the employee punches a wall. What defense mechanism is the employee exhibiting? A. Repression. B. Displacement. C. Intellectualization. D. Rationalization. Correct answer, B. Displacement. Displacement is the redirecting of thoughts and impulses at one person or object to another person or object. Displacement is used when people cannot express their feelings in a safe manner to the person they are directed at. For example, an employee who hates his boss, but can't express his anger at him for fear of losing his job might instead punch a wall. 94. When interviewing a patient, an effective technique that the medical assistant can use is A. Rationalizing. B. Stereotyping. C. Clarifying. D. Probing. Correct answer, C. Clarifying. Clarifying demonstrates the desire to understand what the patient is communicating. The other choices are ineffective techniques. 95. Which of the following is an anxiety about being in situations in which escape might be difficult? A. Agoraphobia. B. Phobia. C. Panic disorder. D. Obsessive-compulsive disorder. Correct answer, A. Agoraphobia. Agoraphobia is an intense fear of being in public places where escape might be difficult. Persons with agoraphobia frequently also have panic disorder. 96. What type of scheduling breaks hour-long blocks down into smaller time increments? A. Wave scheduling. B. Time-specific scheduling. C. Double booking scheduling. D. Modified wave scheduling. Correct answer, D. Modified wave scheduling. Modified wave scheduling decreases waiting time. It is a type of scheduling when hour-long blocks are broken down to smaller time increments. 97. What agency protects workers from health and safety hazards on the job in the workplace? A. CDC. B. OSHA. C. FBI. D. WHO. Correct answer, B. OSHA. The Occupational Safety and Health Administration, OSHA, is an agency of the United States Department of Labor. The mission of OSHA is to help employers and employees reduce injuries, illnesses, and deaths while on the job. 98. What is a recommended way of scheduling so that a physician can catch up with the appointment schedules? A. Schedule at least 15 minutes free in the morning and afternoon. B. Pressure the physician to work faster. C. Have less patients to prevent patient overload. D. Have a strict 10-minute patient rule. Correct answer, schedule at least 15 minutes free in the morning and afternoon. To prevent patient overloading during appointments, schedule at least 15 minutes free in the morning and afternoon. This way, there will be time to accommodate changes in the appointment. 99. What does CDC stand for? A. Community Development Council. B. Communicable Disease Center. C. Centers for Disease Control. D. Central Data Center. Correct answer, C. Centers for Disease Control. CDC refers to Centers for Disease Control. CDC protects people from health threats by conducting research and disseminating health information about the disease. 100. The doctor's office schedules flu shots on Wednesdays from 10 a.m. to noon. What type of scheduling is this? A. Modified wave scheduling. B. Time-specific scheduling. C. Double booking scheduling. D. Clustering scheduling. Correct answer, D. Clustering scheduling. This type of scheduling is clustering. Clustering is when similar procedures are scheduled on predetermined days or time blocks. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.